So, my name is Ashley Robinson. I am currently a senior at Eastern Kentucky University, expecting to graduate this spring. This is my week 8 work product for Psychology 400 at EKU. The focus of this presentation is on enhancing well-being by using mindfulness techniques, particularly in the field of substance abuse recovery treatment. Before diving into the research article, I want to highlight why well-being matters so much in addiction counseling. Although the article I chose to supplement this presentation focuses on opioid use disorder, all substance abuse disorders are not just a matter of physical dependence. These are chronic, relapsing conditions. Some people benefit from medications like buprenorphine, but it is not a cure-all treatment. Untreated emotional and psychological struggles often drive people back to use. There are many different causes of relapses. These can occur during treatment and beyond. A few of the common relapse reasons include stress, cravings, triggers, and co-occurring mental illnesses. Focusing on one's well-being has been found to help with many of these causes. As a future substance abuse counselor, I see this focus not as just an additional part of treatment, but as a core part of treatment. Emotionally stable people have more control on staying clean and rebuilding their lives. Now that I've touched base about why psychological well-being is essential in addiction recovery, I want to introduce the article I chose to focus on for this presentation. The study is titled An Ultra-Brief Mindfulness-Based Intervention for Patients in Treatment for Opioid Addiction with Buprenorphine by Bloom Foster and Mel Madrona, which was published in 2020. This was a pilot study conducted in a primary care setting in Bangor, Maine. The researchers wanted to see whether a very short mindfulness intervention could realistically be delivered by physicians to patients who were just starting treatment for opioid use disorder using buprenorphine, which is a common medication-assisted treatment. The sample included 40 adult patients, many of whom were pregnant or had co-occurring mental health conditions like anxiety, depression, or PTSD. These are the types of challenges often seen in real-world counseling settings. The intervention itself was intentionally brief, only consisting of a 10 to 12-minute scripted session delivered by trained family physicians. It included instructions to participate in a 5-minute guided mindfulness practice to use at home daily. This is something to be considered simple, accessible to all, and easy to incorporate in anyone's daily life. I know this study is not ideal since it has limited generalizability. The sample size is small and is not a randomized controlled study. However, this study is interesting in how it collected both quantitative measures like relapse rates and qualitative interviews by knowing how the participants felt it impacted their lives. This slide highlights one of the most important findings of the study, that a very brief mindfulness-based intervention was not only feasible, but also statistically effective at reducing relapse. To start with feasibility, out of the 49 patients approached, 82% agreed to participate. That is a strong rate of enrollment, which suggests the idea of a mindfulness-based tool is appealing to patients, even those early in recovery who may be overwhelmed or resistant to the idea of traditional treatment. Something that is even more impressive is the follow-up completion rate. 100% completed the 2-month survey, 97% completed the 4-month survey, and 90% completed the 6-month follow-up. That tells us that the patients stayed engaged with the intervention and with their care team, even months after the first session. This is important considering the majority of individuals who seek therapy or counseling of any kind only participate in the first session and do not return. When the researchers looked at patients who practiced mindfulness regularly at home, which was about 3 or more times a week, they had a relapse rate of only 11%. The group that practiced less frequently or inconsistently had a relapse rate of 42%. That is a statistically significant difference. These results show that the intervention was not just accepted, but also effective. Another perk is that it takes less than 15 minutes for the physician or counselor to deliver this treatment, and the patient is only required 5 minutes of their time daily to continue this treatment. This slide highlights how the mindfulness intervention impacted emotional regulation, which is often a seemingly long gone practice in addiction and recovery. This is one of the most important aspects of psychological well being. One powerful addition to this study is that participants didn't just report their thoughts about the intervention itself, they also described moments when they used mindfulness to handle difficult situations, which otherwise could have had a different turn of events. For example, one participant talked about being assaulted with a pipe over a drug debt. He described how instead of retaliating violently, he paused, took deep breaths, and handled the conflict calmly. He credited his actions directly to the mindfulness skills he learned. Other participants reported that mindfulness helped them cope with cravings by giving them a moment of pause between their urge and their reaction. These should not be considered small wins, but rather life-altering moments where mindfulness gave patients the ability to regulate their emotions, which for many would have triggered a relapse. That's what I think is one of the most promising outcomes from the study. Patients didn't just learn mindfulness, they kept using it regularly on their own time. At 2, 4, and 6 months, the researchers found that participants were still practicing mindfulness several times a week. In fact, the average number of practice sessions actually increased over time, from 2.5 sessions a week at 2 months to over 4 sessions by the 6-month mark. Another impressive finding is that 65 to 70% of participants reported that they had practiced within the past 5 days at each follow-up. The level of consistency is remarkable, especially given the challenges these individuals were facing during recovery. Many participants had significant barriers to overcome, like small children at home, lack of privacy, busy work schedules, or no quiet space to themselves. Despite all that, they still made time to practice mindfulness techniques. In interviews, several participants said they practiced at work, in their car, or during stressful moments. These sustained behavior changes show that even a single brief intervention, if it's meaningful and accessible, can create lasting habits. And for people in recovery, building those healthy coping routines can be the difference between relapse and sobriety. Now that I explained the 3 key findings of the study, I want to emphasize why they actually matter, especially for those in recovery and those working within this field. First, the ability to regulate emotions, especially stress, anger, and cravings, is directly tied to relapse risk. We know that intense emotional distress is one of the leading causes of relapse. This study shows that mindfulness gives patients practical tools to de escalate those feelings without turning to substances. Second, this intervention is extremely accessible and practical. Unlike intensive therapy or residential treatment, it is brief, low cost, and can be delivered in outpatient settings, even in rural or underserved communities. This is especially important because many people with substance use disorders do not have access to long term counseling or mental health resources. Third, this study shows how brief interventions can lead to long term behavior change. Patients kept using mindfulness weeks and months later. They did not need to be reminded because they essentially saw the value in it. In other words, the study does not just tell us that mindfulness is effective, but it shows that the clients can actually adopt these practices into their lives, which is exactly what is needed to take control of their recovery. Together, these findings reinforce the idea that psychological well being is not just a byproduct of recovery, but it's the foundation of it. Throughout this course, we have examined how psychological well-being connects to many aspects of mental health. This includes cognitive distortions, self-determination theory, and positive effects of prosocial behavior, all of which help improve one's well-being. The first major one is the Bloom Foster and Mel Madrona 2020 study on mindfulness-based interventions for opioid addiction, which I have focused on in this presentation. These connections show how mindfulness interventions fit into broader psychological theories and evidence-based practices. First, the study aligns closely with Arnick et al. 2016, which examined how cognitive distortions like catastrophizing contribute to depression. Participants use breath awareness to stop impulsive thoughts and reactions, essentially applying real-time cognitive restructuring. This supports the cognitive behavioral therapy idea that changing distorted thoughts improves well-being. One could decrease the likelihood of relapsing if one can restructure the cognitively distorted thoughts that often lead to those slip-ups. Second, Deci and Ryan 2006 reinforces self-determination theory by enhancing autonomy and competence. Many participants continued practicing mindfulness on their own without being prompted. That shows internal motivation and self-regulation, which are key needs in self-determination theory that include someone's overall well-being. Lastly, there's a strong connection with the study by Martella and Ryan in 2016, which showed that pro-social behavior boosts well-being through autonomy and competence satisfaction. Similarly, the mindfulness participants in the Bloom-Foster and Mel-Madrona study reported a sense of control, which is also a core psychological need. These connections demonstrate that the mindfulness-based intervention isn't just effective, but it is supported by various studies. These interventions are a way I can confidently apply these techniques in my future counseling practice. These are the references of the articles I used to make this presentation, which are all peer-reviewed and empirically supported. As a future substance abuse counselor, I hope to bring these insights into practice and to share what knowledge I have learned throughout this course, especially the idea that recovery isn't just about sobriety, but rather about increasing one's overall well-being and ways to build resilience and find their purpose. Thank you for taking the time to listen to my presentation. I'm looking forward to applying this research to make a lasting impact on the clients I hope to serve in the future.